Did you know that scientists have discovered plants that can not only slow the progression of colorectal cancer, but also support the fight against this disease? What's more, their effectiveness has been confirmed by scientific research. In today's episode, I'll talk about plant-based compounds that could revolutionize the way we approach the treatment of this cancer. Stay with me, because what you're about to hear might just surprise you. I want to emphasize that everything I'll be presenting today is based solely on scientific research. You won't find any speculation or guesswork here, just hard facts and commentary grounded in available scientific data. At the same time, I want to make it absolutely clear that I am not discouraging anyone from using conventional treatment methods or suggesting that they should stop them. If anyone watching this episode is considering incorporating any of the plants discussed into their diet or treatment plan, please remember that this should only be done after consulting with your doctor. Why is the scientific community still searching for alternatives and new solutions when it comes to colorectal cancer? Unfortunately, every year, as many as 900,000 people worldwide die from this disease. Even worse, these numbers continue to rise year after year. Why is that? It's a sobering reflection of the modern diet, which is packed with preservatives, heavy metals, toxins, pesticides, herbicides, and many other substances that were once foreign to our digestive systems. Colorectal cancer develops as a direct result of exposure to these harmful substances. And since there's no indication that humanity will return to a diet based on unprocessed foods, these statistics are only expected to worsen. This is why the medical community continues to search for new drugs and solutions to treat colorectal cancer. What's encouraging is that scientists are no longer focusing solely on synthetic drugs. More and more, they are turning their attention to affordable, natural substances that, in many cases, are just as effective as synthetic medications. What do the studies show? That's exactly what I'll be discussing with you today. The first plant that demonstrates anti-cancer properties in the case of colorectal cancer is ginseng. Ladies and gentlemen, ginseng can be divided into two main species: Asian ginseng and American ginseng. Ginseng's effects on the body are multifaceted, making it particularly unique in the context of fighting cancer. It interacts with the hormonal system, allowing it to modulate the progression and development of hormone-related cancers. Additionally, it impacts the immune, cardiovascular, and nervous systems. The key compounds with anti-cancer properties in ginseng are ginsenosides, flavonoids, and polysaccharides. Numerous studies have shown that ginseng can effectively inhibit the growth of cancer cells. However, it's important to note that some of ginseng's active components are only produced in an acidic environment. This is why the presence of a healthy gut microbiome, particularly lactobacillus bacteria, enhances the effectiveness of ginseng. But how do we know that ginseng may have anti-cancer properties? Research on plant-based substances typically begins with animal testing. In the case of colorectal cancer, scientists use a compound called 1,2-dimethylhydrazine in rats to induce tumor development. They then administer ginseng extracts to observe their impact on the progression of the disease. And what did the results show? A 2011 study revealed that red ginseng extract reduces colon cancer cell metastasis both in vitro and in vivo. The study's conclusion states, Korean red ginseng extract can inhibit SW480 colon cancer metastasis, and oral administration of the extract suppresses lung metastasis of experimentally induced cancer cells. This serves as evidence that ginseng can support the fight against cancer. Before we move on, it's worth mentioning two groups of people who should pay particular attention to ginseng: those suffering from ulcerative colitis and Crohn's disease. Why? Chronic inflammation of the intestines significantly increases the risk of developing colorectal cancer. As it turns out, extracts from American ginseng reduce the likelihood of inflammation-associated colon cancer and inhibit its progression. Research confirms that American ginseng may be effective in both the prevention and supportive treatment of colon cancer in individuals with inflammatory bowel diseases. All right, we've covered quite a bit about ginseng. Now let's shift our focus to traditional Chinese medicine, which has been using natural substances to treat various ailments, including cancer, for thousands of years. One of the most well-known examples is an herbal formula called PHY-906, which has been used in China for nearly 2 millennia. This formula consists of 4 plants: Baikal skullcap, Chinese peony, Chinese licorice, and jujube fruit. Interestingly, these plants are used in very specific proportions, 3 to 2 to 2 to 2. But what makes this formula so unique? The purpose of this formula is not only to support the treatment of colorectal cancer, but also to alleviate the side effects of chemotherapy. First, PHY-906 improves appetite, which is crucial for patients who often experience significant weight loss during treatment. Second, it protects the liver, provides pain relief, and reduces nausea, vomiting, and fever, symptoms commonly associated with chemotherapy. But that's not all. PHY-906 also reduces the gastrointestinal toxicity of a chemotherapy drug called irinotecan. This is particularly important because protecting healthy cells during treatment can be critical to the recovery process. What else sets this formula apart? In addition to reducing toxicity to healthy cells, PHY-906 enhances the anti-cancer activity of irinotecan. This means it not only protects the body from side effects, but also boosts the effectiveness of the drug itself. Furthermore, the formula helps mitigate weight loss and accelerates the regeneration of intestinal epithelium, which is crucial for patients with colorectal cancer. But let's take a look at what the research says. In 2010, a study demonstrated that the Chinese herbal medicine PHY-906 reduces gastrointestinal toxicity caused by chemotherapy. The study's conclusion states, "Our results show that the herbal medicine PHY-906 can counteract irinotecan toxicity through several mechanisms acting simultaneously." This is yet another piece of evidence that natural substances can support cancer treatment while simultaneously minimizing the side effects of therapy. But that's not all. Traditional Chinese medicine and modern scientific research point to many other plants that can support the fight against colorectal cancer. Let's now move on to another plant that has been renowned for its medicinal properties for centuries: turmeric. Turmeric, or more specifically, its active compound, curcumin, has been drawing the attention of scientists for years due to its anti-inflammatory and anti-cancer properties. Curcumin works on multiple levels, inhibiting the growth of cancer cells, reducing inflammation, and supporting the immune system. Moreover, studies have shown that curcumin can enhance the effectiveness of certain anti-cancer drugs while simultaneously reducing their toxicity. Scientific research confirms that curcumin, the active compound in turmeric, exhibits strong anti-cancer properties. For example, a 2013 study demonstrated that curcumin inhibits the proliferation of colorectal cancer cells and induces their apoptosis in a dose and time-dependent manner. The mechanism of action involves the activation of caspase-3 and the regulation of proteins such as p53 and PRP4B, which play key roles in cancer processes. These findings suggest that curcumin could be an effective agent in supporting the fight against colorectal cancer. But how can we best harness the benefits of turmeric? It's important to remember that curcumin has low bioavailability, meaning the body absorbs it in small amounts. For this reason, it's recommended to combine turmeric with piperine, a compound found in black pepper, which can increase curcumin's bioavailability by up to 2,000%. Additionally, using turmeric alongside fats further enhances its absorption. Turmeric is just one of many plants that can support the fight against colorectal cancer. Let's now move on to another plant that has been used in natural medicine for centuries: ginger. Ginger, primarily known as a spice, also possesses strong anti-cancer properties. Its active compounds, such as gingerol and shogal, exhibit anti-inflammatory and antioxidant effects. Moreover, studies have shown that ginger can inhibit the growth of colorectal cancer cells while simultaneously supporting healthy cells. A 2014 study revealed that gingerol, one of the main compounds in ginger, inhibits the growth of colorectal cancer cells by affecting their cell cycle. The study's findings indicate that gingerol exhibits strong anti-cancer properties by suppressing cancer cell proliferation and inducing apoptosis. This is yet another piece of evidence that natural substances can support the fight against cancer. Ladies and gentlemen, in today's episode, we discussed several plants that can support the fight against colorectal cancer, including ginseng, the PHY 906 formula, turmeric, and ginger. Each of these plants has unique properties that have been confirmed by scientific research. Would you like to see another episode about other plants and substances that may aid in the fight against cancer? If so, let me know in the comments. Thank you for watching, and see you in the next episode.